What counts toward my out-of-pocket limit? Imagine facing a big medical bill and wondering how much you will really have to pay. Knowing what counts toward your out-of-pocket limit can help you plan your healthcare costs better. The out-of-pocket limit, also called the maximum out-of-pocket amount, is the most you will pay in a year for covered healthcare services before your health plan covers 100% of the costs. This limit usually includes your payments for deductibles, co-payments, and co-insurance for services your plan covers. If you have a Medicare Advantage plan, which is also called Medicare Part C, your out-of-pocket costs for in-network services are capped annually. This includes your payments for hospital stays, doctor visits, and other covered services under Medicare Parts A and B, but remember, it does not include your monthly premiums or costs for services not covered by Medicare, like dental or vision care. Some plans combine in-network and out-of-network costs into one higher limit. Once you reach this limit, your plan pays all covered costs for the rest of the year. For people with original Medicare, which includes Parts A and B, there is no out-of-pocket maximum. You pay deductibles and co-insurance for hospital stays and medical visits, but costs can add up without a set limit. For example, after a hospital stay, you might owe a deductible for each benefit period and co-insurance for days spent in the hospital. This means your costs can grow large if you need a lot of care. If you have a Medicare Part D plan for prescription drugs, there is a separate annual out-of-pocket limit for medications. This includes your deductible, co-payments, and co-insurance for covered drugs. When you reach this limit, you enter what's called catastrophic coverage, where your costs for prescriptions drop significantly. It is important to note that your monthly premiums for any Medicare plan do not count toward your out-of-pocket limit. Medigap plans, also called Medicare Supplemental Insurance, help cover some costs left by original Medicare. These plans do not have their own out-of-pocket limits but can reduce your expenses by paying some deductibles and co-insurance. What does not count toward your out-of-pocket limit? Your monthly premiums for Medicare plans are not included. Costs for services not covered by Medicare, like most dental, vision, or hearing care, do not count either. If your plan separates in-network and out-of-network costs, expenses for out-of-network care often do not count toward your in-network out-of-pocket limit. Also, any expenses for medications or services that Medicare does not cover are not included. Knowing what counts toward your out-of-pocket limit helps you plan your healthcare spending. If you have a Medicare Advantage plan, you can benefit from a cap on your annual costs for covered services. If you're relying on original Medicare, you should be prepared for potentially unlimited costs, which makes supplemental coverage like Medigap a good idea. For prescription drugs, understanding the separate drug cost limit can help you manage medication expenses better. Being aware of these details allows you to make smarter choices about your healthcare coverage and budget.